So welcome, everyone. It's my pleasure to introduce Daniel Thompson. We're excited because Daniel is a communications and a partnership specialist at the CDC Foundation, and I'm sure he's going to tell you exactly what the differences is between the CDC and the foundation and whatnot. But, you know, he was detailed over to the foundation to fulfill activities in the fall prevention program. He's had over 11 years experience in public health communication, health policy, partnership experience. So we're getting somebody who's a seasoned specialist. He also worked for the Advocacy for Children's Healthcare in Atlanta. I know he's based in Atlanta. I think he will tell us all about that too. I'm hesitating because I can't walk and chew gum at the same time. I'm looking at the waiting room and putting people in and also trying to introduce our speaker. So Daniel, I'm going to turn it over to you and you can start. All right.
Thank you so much, Barbara, and thank you for having me today. My name is Daniel Thompson, and yes, I am based just outside Atlanta, about an hour north in Gainesville, Georgia, near Lake Lanier, if anyone knows who that is, where that is in Northeast Georgia. But yeah, the topic today is something that is very personal to me. I had experience in this in helping to prevent older adult falls, and also as a person who has fallen in the not too distant past myself. But this is our topic today is going to be about fall prevention, fall screening, and fall prevention. So yes, as Barbara said, the CDC Foundation, which it was congressionally created to assist CDC in doing more public health prevention projects that may not be funded by the federal government. CDC Foundation is in a position where we can raise private dollars and support CDC, and then the foundation can also do its own projects as well. But that's the approximate difference between CDC and CDC Foundation. But the project that we've got that we're working on now, CDC Foundation has a older adult falls prevention project that we're working on very closely with the CDC Division of Injury Prevention. The purpose of the project is really to create two new tools for older adult fall prevention. One is for screening of older adult fall risk factors, to educate older adults on their risk for sustaining a fall. And the other tool is being created to help plan for preventing a fall from ever happening. And that tool is still in development. I'll talk about that in just a minute, but let's move forward a little bit through the agenda. So we're going to talk a little bit about the burden of falls here in the United States to give everybody kind of a sense of what the magnitude of the problem is that we're facing and trying to prevent. We're going to talk about our fall screening tools. We're going to do a fall screening tool demonstration. I'm going to show you the Falls Free CheckUp that is brand new. Back in September, we had it launched through the National Council on Aging. And then I'll talk about some fall prevention resources that CDC has to make sure that you are aware of everything and all the education that's out there, and then we can have some discussion. I've only got probably about 30 minutes of content, so we can have hopefully some good discussion after that. So let's start with what we know about falls. We know they are common. They can be very costly, but they are also many times preventable among adults age 65 and up. In fact, a fall occurs every second in the US among older adults, and there are about 100 fall-related deaths every day. As staggering as these numbers are, we estimate that less than half of older adults tell their doctor about a fall. This is especially concerning when we consider the fact that falling even once doubles your risk of falling again. So armed with this information, we're engaging in this fall prevention initiative with the goals of increasing awareness about falls and fall risk among older adults and their caregivers, and developing tools that will play a role in reducing the risk of falls. So this, just to give you a sense, this is in the United States, the age-adjusted percentages of older adults reporting a fall. And you see here the darker shades of states. They have reports of older adult falls higher than the national average, with the highest being Alaska. And then the lighter shades are significantly lower than the national average for older adults reporting a fall, and that would be Illinois. And so you can see where Virginia is. I think this is, most of the people on this call are from the Capitol Hill area, but you see Maryland and Virginia there. And then these are the age-adjusted older adult death rates by state. Again, the lighter shade of blue is significantly lower than the national average, with the lowest being in Alabama and the highest being in Wisconsin. And the differences between the states, certainly states are very different in their abilities and their resources for public health prevention, but there could be vast differences in local and state fall prevention efforts. There could be, certainly there are differences in access to care and fall prevention services. And then, of course, each state has its different ways of doing state level death certification practices. So how the causes of deaths are coded could be different from state to state. So a few things I want to be sure that that I make clear about fall prevention. Number one is that falling is really not a normal part of aging. That's not something that we should expect that just happens as a part of aging. Many falls can be prevented. And you should tell your doctor if you have fallen in the last year. I know in some of the research that we've done in developing these tools, it is often the case where older adults feel that their doctor doesn't have time, or there's more pressing issues that they want to talk about with their doctor, or maybe their doctor doesn't care. Perhaps the patient doesn't feel that the doctors would really be concerned about, oh, clumsy me tripping over a step or whatever. But it's actually really important that you report that, especially if you're 65 and older. And then really you should screen yourself for fall risk every 6 months. And this ad here, this image here on the right side of the slide, is part of the promotional effort, promotional material that we developed for creating the Falls Free CheckUp that I will talk to you about in just a minute. So screening for fall risk. Screening for fall risk is really important, and CDC has done some work prior to the Falls Free CheckUp about screening for fall risk. This is an image of the Stay Independent Screener. It is an evidence-based, paper-based screening tool that's available on the CDC website. It has 12 questions that older adults can complete on their own and offers insight into specific fall risk factors. And additionally, a completed Stay Independent Screener is a great thing to show to your healthcare provider to have that conversation about understanding your modifiable risk factors. And so you can find this on the CDC website. Moving from the Stay Independent Screener, which is there, to the Falls Free CheckUp. The Falls Free CheckUp is the online version of the Stay Independent Screener. And it was released, like I said, back in September in partnership with CDC Division of Injury Prevention, our partners at the National Opinion Research Center at the University of Chicago, and the National Council on Aging. It is adapted from the Stay Independent Screening brochure, and it can help predict a normal or high risk of falling in the next year. So there's no low risk of falling. Everybody's, has some risk for falling, and that's a normal risk. And then there's obviously the higher risk for sustaining a fall. And you can find that at the website there at the Falls Free CheckUp. So this is a screenshot of the Falls Free CheckUp, and there is a video that I'm going to show you that talks about the high risk. And so what I'm going to do now is run through a quick demonstration of the Falls Free CheckUp. All right. Barbara, if you can just confirm that you're seeing this screen with the questions on it.
See them.
All good?
Yep, we're
Great.
good. The NCOA A12 planner. Yeah.
Yes. So this is the Falls Free CheckUp. And as you can see, there are some questions here that I will just run. I'm sorry? No? There's some questions here that I'll run through. You can select for the page to be entirely in Spanish. They're at the top right. But these are 13 questions to get your fall risk score and resources to prevent falls. So the information you will be providing, we actually have a selection here for if a caregiver is filling this out for an older adult, or a doctor or a nurse filling it out for her patient, or perhaps a professional caregiver filling it out for a client. So I'll select my own information. The first question, I have fallen in the last year, and they're all yes or no questions. So I'll select yes. And then here on the right is a question mark. And that is for more information about, maybe if you have a question about why we're asking this question. So this helps you understand sort of the evidence behind it. People who have fallen once are more likely to fall again. And then I use or have been advised to use a cane or walker to get around safely. Yep. Sometimes I feel unsteady when I'm walking. I steady myself by holding onto furniture when walking at home. I'm worried about falling. I need to push up with my hands to stand up from a chair. I have some trouble stepping up onto a curb. Often have to rush to the toilet. Incontinence is a risk factor for falls, so it's good to talk to your doctor if you're having to go to the bathroom urgently. I've lost some feeling in my feet. That could be a risk factor for a chronic disease that may need to have some additional management. I take some medicines that make me feel lightheaded or more tired than usual. I take medicines to help me sleep or improve my mood. I often feel sad or depressed. And so once you click that last question, you see the Save and Continue button is highlighted. But before we click on that, I wanted to turn your attention to these questions at the bottom. These are the frequently asked questions that we identified here at the bottom. So, they all, if you just click on them, they will drop down for an answer. I am healthy and active. Am I really at risk for a fall? Do I need to get my falls risk score if I've already talked with my healthcare provider? Are falls a natural part of aging? We've already covered that. No. Should I really be worried about falls? So those are the kind of the top questions that we identified that are there. And then there's more frequently asked questions underneath those if you're curious. So we'll hit Save and Continue, and it will calculate the fall risk score. And here we are at the results page. So you see clearly there at the top, it says results, fall screening results. You have the date, the screening date of Tuesday, March 14th, which is today. That's good to have, especially for your healthcare provider, for him or her to know when you screened yourself or when the screening was completed. And then you see clearly your falls risk is high. So this is letting you know that you've screened for high risk. And then this video here will walk us through what these results really mean. And so, Barbara, I'm going to click play. And my hope is that the sound will carry through to to you. So if it doesn't, please let me know.
Congratulations on taking the Falls Free CheckUp. It's a great step to prevent future falls, and to keep your independence.
Based on your answers, your risk of falling is high.
So the first thing you need to do is to call your doctor and schedule an appointment to go over the results.
That's right. Doctors are busy, but they need and want to know about your health. Download your results below and share them with your doctor.
Your results report will help your doctor determine what steps to take. Together, you can make a plan to avoid risk and future falls.
Waiting for. Schedule an appointment with your doctor today so you can remain injury-free
and independent.
So that was the video. I hope everybody could hear it okay. But then the text below talks about your fall risk score and what the score is. So I answered the maximum risk that I could. So it scored at 14. And it talks about what that means. And then here at the bottom, the next steps for you to take. So really, we want the message to ring very clear and loudly that the most important thing you can do today is to schedule an appointment with your doctor or healthcare provider to discuss your falls risk and make a plan to reduce them. So that's the big takeaway from the Falls Free CheckUp is to make an appointment with your doctor. So we have here the ability for you to schedule a reminder. So if you click here, it will ask you to input your email address, and it will, in a few weeks, send you an email to remind you to schedule an email address with your healthcare provider. One thing I just failed to say at the very outset is that the Falls Free CheckUp is free at the point of demand. There's no requirement to create an account. You don't have to input your email address, just like I was able to start it on my computer screen right here without having to log in or to input any information. Nothing is required to take the screening. But if you do want a reminder to be sent to you, you do have to input your email address, and NCOA will send you a reminder to schedule an appointment with your doctor. You have the ability to download your full Falls Free CheckUp report, which includes a letter to your healthcare provider and also all of the questions that you answered yes to on the Falls Free CheckUp to give your healthcare provider a sense of what your modifiable risk factors are and where your doctor should focus in the prevention of a future fall. And then you can email a copy of your Falls Free CheckUp report. Again, you'd have to input your email address to be able to send it for NCOA to send you a copy of your report. But it's there, and multiple ways that you can see your report. I mean, you can even print it out if you prefer to do that. But it's lots of steps that you can take to make sure you have the information that you need and you're armed with that information to talk to your healthcare provider. If you have access to a patient portal, if you communicate with your healthcare provider via a patient portal, some of them I think have the ability for you to attach a file to a message that you can send securely to your healthcare provider, and so that's another way to do that. If you download the report to your computer, and then you can upload it to the portal there if you have that capability. And then here are some more steps at the bottom that you can take to prevent falls. Talk to your doctor, make sure that they are reviewing your medicines to make sure there's no conflicting prescriptions that may cause any unwanted side effects that might increase your risk for a fall. Ask for a physical therapy assessment from your healthcare provider. Get your eyes checked if you haven't had that done in a while. And then obviously make your home safer. And CDC has a great check for safety brochure as a guide. And there's a link to it there that you can go through to make sure your home is safe. And then some other resources here at the bottom. We really wanted to make sure that we provided the user with all the resources that are evidence-based and that have the potential to make a difference in fall prevention. So this is the Falls Free CheckUp. Now we'll go back to the presentation. All right. So moving on. So the other tool that we're developing, as I mentioned before, is a fall prevention planning tool. This is we're aiming for a launch date of sometime in 2024, hopefully around May of 2024. It's still very much in the development phase. We got a long way to go, but we're excited and looking forward to launching it fully next year. We are tentatively calling it the LIFE tool, or Living Injury Free from Falls Every Day. And it really is to inform older adults about their modifiable risks, and gives them a plan, or the older adult, the user of the planning tool, can select the components of their modifiable risks and add them to a cart. It's a interactive tool that we're developing, kind of like shopping for prevention. So, you go through the modules. It's a module-based planning tool. And at the bottom of each module is action items for that risk factor. And you can click on those and add them to your cart. And at the end of the tool, then you have the things that you want to focus on for your fall prevention planning efforts, and you can print those out or save them, make a kind of an easy to read resource for yourself right there on the website. So we're very excited about that. And just quickly, some other injury prevention resources that are available for you to educate yourself and take action to prevent falls. We have the Still Going Strong campaign that was created a couple of years ago with a theme of aging without injury. And it was based on data that falls, motor vehicle accidents, and traumatic brain injuries are a growing problem among older adults in the United States. CDC's goal was to empower older adults and their caregivers to be aware of common injuries that can be prevented as they age, and aware of specific steps they can take to reduce their risk of injury. The campaign may empower older adults and their caregivers to address fall risk factors, traumatic brain injury, motor vehicle safety, and adult mobility. And so that is kind of the all-encompassing Still Going Strong campaign. There's lots of resources in English and Spanish on the Still Going Strong website that you see there at the bottom of the screen. And as I said, the goal is to empower and encourage older adults to stay active and take steps to prevent injury. This campaign launched a couple of years ago, and it's planning to do a relaunch of some more communication efforts. So hopefully you will see some of those in the coming months. A part of Still Going Strong is the My Mobility Plan. This includes how to stay independent, to maintain tips to manage health and to maintain mobility, how to stay safe at home. There's a home safety checklist included, and to how to stay mobile in the community. And this is the kind of the added component of My Mobility. Along with our transportation safety team at CDC. We want older adults to think, how they're mobile in the home and they're active and staying injury-free in the home. But, let's think about ways that we could be more informed or safer, when we are driving, or in the event that we're no longer able to drive, how do we get around our community? What's our plan for being mobile in our community? So there's it's a 4-page plan. It's paper-based, and so it's there on the CDC website at that link at the bottom of the slide. But there's several questions that it asks you around these areas of being independent, staying safe at home, and being mobile in the community that can help you plan for staying safe. And this is what the plan looks like. This is kind of the top of it. Like I said, it's a PDF, 4 pages there on the My Mobility page at CDC. And then nearing the end here, I just wanted you all to be aware of the brand new compendium of effective fall interventions. We know that many of the risk factors for falls are modifiable. So, common sense tells us that by modifying one or more risk factors, we can have a positive impact on fall prevention. But we also have research data to quantify this and really drive home the fact that falls and fall-related injuries can be reduced with proven techniques. So this compendium, which is in its 4th edition, it came out in January of this year, includes research from single method and multifaceted interventions that are effective in either a community or clinical setting. So, for example, a community-based Tai Chi program was shown to reduce the risk of multiple falls by 55%. So Tai Chi is one of the evidence-based activities for falls prevention. So this is on the CDC website. It may be a little dense, but if you're interested in learning a little bit more about the data, it is there, and I wanted to make sure you were aware. So what you can do today for falls prevention and staying healthy and independent. The first step is obviously take the Falls Free CheckUp, see what your risk is, and then definitely schedule an appointment with your healthcare provider if you have not already done so to talk about your results. And then visit the Still Going Strong page and My Mobility page to understand a little bit more about those resources and any education there for you to help you in your falls prevention and injury prevention efforts. And then encourage your friends. I would say, this is this organization, the Village to Village Network. This is a community-based organization. There's organizations in neighborhoods and in communities. And so my hope would be that the villages could meet and talk about this and kind of make injury prevention a real priority for the villages. So this brings me to the kind of the end of my prepared content presentation, and I want to thank you first for allowing me to talk with you about the resources that we have developed, the Falls Free CheckUp, and coming soon the Fall Prevention Planning Tool, Life Tool. But I did want to ask a couple of questions and obviously pause for questions to see if there's anything burning in the chat that I can try to address, and just have some time for discussion. I think we have a few minutes left in the hour, and want to just turn it over to Barbara to see if there's any questions from the group or if she has any questions.
No, Daniel, that was awesome. Thank you. And I'm sure I have questions from the audience. But what I want to say is, just makes me remember back being an ED of a village in Northern Virginia, and we had an intern that did a survey on falls, and a third of our members, we had a great, outpouring. A third of our members sent the survey back saying they had fallen. And we partnered with what was at the time Gold's Gym, and they started a fall prevention class. We went to them and said, here's a group that is interested. So it's just an example of how villages can get involved. My pal, Bill Kincaid.
Thanks, Barb, and thanks, Mr. Thompson or Dr. Thompson for the work that CDC does. I am a former local health officer, so I am well aware of what the CDC does. And many times the A and prevention part of your name is left out. And I think it's one of the most important things that you all do. And I think this is a real step forward in terms of getting the villages to pay more attention to this problem. I am also a rheumatologist, retired, and I know this is a big issue. And I think if we can get the word out, put this in the newsletters we send out, post it on the websites, I think it will make a big difference. And I want to thank you for the work you guys are doing down there. I know it's been a tough couple of years for you, and we appreciate what you're doing. So, thanks
Yes,
a lot.
sir. Yes, sir. Thank you. And my father was Dr. Thompson, and I didn't go quite that far. So Mr. Thompson is wonderful. Daniel's even better. But thank you for your comments. And yes, the prevention part is certainly it comes at the end, but it's a big part of what CDC does. So yeah, just like you,
it should be at the beginning.
well, see if we can raise that up in our next strategic plan.
Yeah.
But yeah, I mean, I think we're really trying to work hard to get the word out, and so being able to speak to groups like yours is immensely important. Because these resources, a lot of work has been behind them, been done to get to this point, and they're all based in evidence and science, and so they're the best of what we have, and they really are proven to be really effective. And so we hope that people will use them and find them helpful, and stay in touch about how they are interacting with their lives, and hopefully making things better.
Right. We did have a question from Margaret, of course. She said, having experienced several falls over the recent past, I would be interested in how to fall, what to do when you know you're going down to minimize damage. I don't know if you can answer that, Daniel, but there might be some materials that are accessible to some of our villages, on minimizing risk.
Yeah, I mean, unfortunately, CDC is in the foundation. We are really focused on the prevention of the fall in the first place. We don't want to get to the point where we are talking about how to fall and how to fall effectively or safely. I don't know personally what the evidence is around that, but we feel that the prevention of the fall, the exercises, making sure your medications aren't fighting with each other, or not giving some unintended consequences, some unintended side effects, that your home is safe. Those are the things that are really going to keep you the safest. That's what the evidence is showing. So I don't unfortunately have a real great answer.
And one of the things, Margaret, that I would say, and I did this back as an executive director, is we had a physical therapy group come and do a lecture. And it wasn't just about falls and prevention and ways to sit, and whatnot, but it's also how to get up from a fall. And some of these professionals will come out and do lectures, and it's a great resource. And the other component I wanted to just mention, then I'm going to go back to the chat, is up here in New Jersey, the state of New Jersey promotes, and it's similar to what Daniel, you said, as far as we have a Live Strong program that is a free 12-week program, and they do a joint venture with local nonprofits, and the one up here is with JFS, and I did it. It's a 12-week, free class. It's group classes, and they continue to do it. So my point is, go to your state and look up free. I just Googled free exercise classes or group classes. There's a lot of states that are promoting falls prevention, and so that would be a great resource to look it up and see if there's something going on. And again, it's being funded through the state of New Jersey, so it's a wonderful program, accessible to everyone. In the chat, we also had one from Nicola. She said, we regularly include information about falls in our monthly newsletter. I found many people to be resistant to acknowledging their risk for falls. I think it's large part a cultural issue, which is true. How do we counter that culture of celebration of youth and independence to help people realistically with the risk? Have you found that people aren't self-reporting falls or?
Yeah, so they are self-reporting falls, but not to the extent that that we would like. Only about half of older adults report a fall.
Yeah.
So so it's, you know, it's something that we would hope with fall prevention resources that older adults might feel more comfortable reporting this to their healthcare providers if we can promote the resources more effectively, and really the message of talking to your to your healthcare provider about your fall. Make the appointment about fall prevention. Don't make it about 17 other things. Make the appointment about fall prevention with your doctor, and so they know that that is the thing that you want to talk about. I know there's, you know, lots of things, and you only get a certain amount of time with your doctor, and you know, oftentimes we feel rushed to make sure we get everything covered. But you know, if they know it's a priority for you, then you know, my hope is that they'll make that time.
Oh, good. Has Abe asked in the chat, has the CDC falls prevention done any outreach to the medical community to make them aware of these questionnaires?
Yes, there is actually a healthcare provider focused older adult fall prevention or screening older adult fall screening and assessment program called STEADY. And STEADY is an acronym that stands for Stopping Elderly Accident, Death, and Injury. And that is something that is targeted to the healthcare provider community about older adult falls specifically. There is a whole clinical algorithm that's been developed with CDC along with other experts, clinical experts in older adult falls prevention that's been developed. And it is, it's been out for a couple of years now. But the healthcare provider community is aware of it and uses it. Many of them use it and are trying, in some cases, trying to make it a part of the electronic medical record so that if they are assessed for fall and fall risk, then it's just kind of automatically built into the health record to go through a kind of a checklist to make sure that the modifiable risk factors that that the healthcare provider can focus on in that visit are addressed, and hopefully they can be modified so that those risks are a little bit lower. But yes, and for this initiative with the Falls Free CheckUp and the fall prevention planning tool, we have engaged with the medical community. Number one, they were engaged in the development of it, but number two, they're aware that it's out there. I have been communicating with national healthcare organizations as well as a few at the state level, physical therapy, American Geriatric Society, to let them know about this and to make sure that they're aware of the promotional materials to send out to their members as well. So the answer is yes, we've been talking with the healthcare provider community.
Terrific. And Lisa just put the link to STEADY in the chat. So if anybody wants to look at that.
Thank you.
Any of my Virginia villages on the call, I just wanted to talk about a program, and I didn't specifically ask them to come on, but there are a bunch of Virginia villages that have been participating with Mary Washington University. No. Yeah, Marymount. Sorry, Marymount University. And I mean, we're going on 5 years that they've been doing this partnership and bringing it into the village. And I do believe it's evidence-based programming that they're doing, but it's another collaborative that villages can look at to partner with local universities or, social work departments to do a falls prevention. And like I mentioned, I think the key, and I forget who said it, about Nicola, about people not wanting to, say they fell. Well, our survey was anonymous, so you could just send it back. But we sent out 130 surveys, and we got like 110 back, and they didn't have to put their name. I mean, we had but it was all snail mail because that's the way my village operated, But the beauty was that we got the information out, and people didn't have to disclose that they fell, because there is a stigma when somebody, says, oh, they fell, or, there's a volunteer may say, oh yeah, so-and-so fell, but they don't want to tell you. And so the villages end up finding out eventually. So it might be a way to open the door a little bit to see if there's interest. Any other questions, comments?
Or any feedback to some of the questions that are on the screen right now. I would be very curious to know if there are any fall prevention activities that are currently underway in your villages, or are there any barriers that you foresee to starting any kind of fall prevention communication effort or promotion or program, or if there are any suggestions that you have for communicating effectively about injury prevention to older adults, and if there are any trusted sources of health information. We're always looking for input, for best ways to communicate. So yeah, would love to hear any feedback on those or anything else.
And also, I wanted to ask quickly, Daniel, I mean, one of the things that our villages all experience are some of our folks that are homebound, and how to help them, into the home. I mean, are there mechanisms built in with the falls, or interactions that our villages, and I know that anybody who's homebound is eligible for physical therapy in the home. But to get to that point, you have to go to the doctor, you have to do this and that. But is there any initiatives to help some of our homebound folks to do balance and strengthening, individually,
Yeah, so it's in development. The answer is yes. It's in development. Still Going Strong is looking at that very issue for another launch, a kind of a Still Going Strong Part 2, if you will. So that part of it is definitely being considered right now in some formative research for communicating to vulnerable populations about those kind of unique experiences, as well as making sure that Still Going Strong is culturally, racially, ethnically diverse and inclusive in the messaging and the programmatic options. So more to come, definitely on that. So great question, and yes, it's coming.
Okay, good. Does the foundation have any other materials for promoting that maybe the villages could distribute to their own? I mean, like articles or, like you name it, any resource. I mean, all of us have our newsletter, and the resource to get to our folks, within our member villages.
Yeah. So on the CDC Falls program page is a link to our partner toolkit, which has all sorts of images, social media suggestions, newsletter articles. We've got just all kinds of draft material, anything that you want to, either take, take from directly from the partner toolkit and promote, or any images, GIFs, or just still images that you want to promote in your newsletters. It's all there on the CDC Falls program page, and I'll make sure that y'all get a link to that very shortly.
And also, if you wouldn't mind, would you share your presentation with us so that we can send it back out to everyone?
Happy to.
Please.
Happy to. Yes.
Okay. I don't think Daniel can answer this question. What happens when a member is volunteering and to help another member and that member falls, possibly injuring themselves? Maybe another village can answer that. Thank you, Lisa, for putting this still going strong in there. We all fear that our volunteers are at risk sometimes, and I'll answer this. I know Daniel can't answer this on behalf of the villages. So we are still in the frail members webinar, or, vulnerable members. It's that open line of communication with the volunteers. If somebody is, if a member knows another member's at risk for falling, that it's a conversation to have with that member, but also with the director or, the head of volunteer services. Because nobody wants to put a volunteer at risk. And so I hope that answers your question. Anybody want to comment on that? Those of you who are either executive directors want to chirp in on that one? No. Okay. Thank you, Daniel, for putting in the foundation programs on Falls, and Lisa, the 2 CDCs. And I threw in the one with the National Council on Aging, where you have the checklist. Any other questions? No? You guys are all quiet today. Oh, hold on one second. So Lisa, there is quite a number of Falls fact sheets, pamphlets that you can order hard copy. You'll find them on the websites above too. Oh, fabulous. That's great. It's worth having a conversation. I mean, everyone, I'm sure, watches the news, and what was in the news the last week? Mitch McConnell fell. And he's at a restaurant and he falls. And thank God he's okay, but it happens. And now they're realizing that he may have broken a rib too. I mean, falls are dangerous. I mean, just, it's when someone says they fall, they don't realize the seriousness of a fall. I mean, the concussion, somebody who's in his 80s, hospitalized for 5 days, and, having to do acute rehab. So it's getting ahead of the game, being able to do, some of the exercise, and partnering with local organizations to further the conversation. And I think you'll have partners out there. Anyone else? Oh, we have one more chat. Let's see. They're all free. Oh, thanks, Lisa. Thank you for all the resources. Daniel, thank Lisa, you for all the good information. Paul, I think you have a question.
Yes, I was going to respond to something. I thought about it for a moment, and I'm going to respond to the part about falling. In my neighbors is the name of our village. We have an official policy that says if a volunteer is next to a member and they fall, you have to leave them down there and call 911. Okay, that's the official policy. We live in a country that's really crazy about litigiousness and healthcare and money and all that stuff. What actually happens is volunteers safely, if they know how, reach down and help the person up and then assess to see if they actually have an injury. My own experience with this was 100 yards from my house, a neighbor who was being assisted, quote unquote, by a paid assistant who was walking 10 feet away from him when he fell. He broke his hip. I helped him up onto a chair. We had to talk them into calling the ambulance. The ambulance came. They did not assess for a broken hip. They just loaded him in the ambulance and took him off. Well, he was in dementia, living with dementia for some years, and the hip was broken. The surgery happened. That meant general anesthesia. And that meant that 10 days after he fell, he was dead. Because when you have dementia and general anesthesia, they don't go well together. So there's the idea of what we are supposed to do, there's the written policies, and then there's the reality of the world. So I think that my takeaway from that is more people need to have more training about what to do. I appreciated Ms. Horst's question about how to fall. I think it's a good idea to know these things. It's a really good idea that I had not thought about, to know how to get up again or how to assist someone getting up again. So whether the official policy says yay or nay or in between, I feel that if you want to be personally responsible, learn a few things, practice a few things, learn some Tai Chi, follow all these recommendations that the CDC Foundation manages, because prevention is so much better, but you can't stop with prevention. I'll shut up.
No, I like your comments. Thank you, Paul. And it makes me think, you know, my husband fell last week and I could not get him up. And I remembered the lecture on how to get up from a fall. And he was safe, he was fine. But it really is the tools that, you know, we need as we move forward. And yes, you're right. I mean, we are a litigious society, but at the end of the day, we're all human beings too, and we want to help. So I appreciate that. Anyway, so last, Abe says, based on this discussion, could or has the CDC worked with government towards volunteers being protected from liability while on duty? Oh, good question. I don't know that.
See, I don't know the answer to that question, but what I do know, based on my history as a lobbyist in Georgia, is that states have the ability to create basically laws that are called Good Samaritan laws. And so that is in the event where if you come upon somebody who may be having cardiac arrest, you didn't see them go down, there's no one else around, and you perform CPR and you know are able to save them, and they are transported to hospital and revived. But during the course of that, you break a rib performing CPR. You know, the patient is not allowed to sue you because you were acting in good faith as a Samaritan. So that's the best I know in terms of you know, volunteers and liability. But I don't know about CDC specifically.
And let's keep in mind, every state's different. Every state has their own governance and laws. And we all know this because all of our insurance policies are so different from state to state, you know, under our villages. So it's worth exploring. But anyway, thank you. Thank you for your comments, Daniel. Oh, Dennis, do you have a question?
Yes, I'd like to follow up a little bit on what Paul said. My sister fell in New York with some family doing a tour, hit her head, and she didn't want to go to the hospital, be checked out because it would interfere with the time everyone was having. Fast forward several months and she's having problems, and she gets an MRI scan and finds out that she has a TBI. And her left frontal lobe is considerably reduced in size. It's shrunk, and she's having cognitive difficulties. So I would add to what Paul said is anytime you have a fall of any consequence, you ought to have it checked out medically and not just go forward. Because we all read in the news how many instances people have had concussions or brain injuries, and they haven't checked it out, and then the problem surfaces in a very serious form later.
Well, thank you. I'm sorry. I think we're out of time. Bill, do you have last comment?
I was just going to say, I think that's good advice. I think for people who have a meaningful fall, particularly those who are on a blood thinner, definitely should be checked out, because that is exactly the risk factors that can lead to problems. So I think, again, common sense is great. We do have a policy, but I think you need to follow up and make sure that there isn't an injury.
Yeah. Good. Well, thank you all for coming on. Daniel, we really appreciate you sharing this and all your stories. And we will share the video and Daniel's PowerPoint and all the other links as a follow-up in our newsletter. So enjoy. Hope those of you that are having the weather, unfortunate weather, you navigate it very well. There's in the Northeast and in California. We're all thinking of you. Thanks again, Daniel.
Thank you so much.